sure. Yeah, so what we see kind of in the healthcare space and in our industry is, especially since the pandemic hit, a lower than typical applicant volume. Our applicant volume certainly dipped over the last few years. There's been some positions that become harder and harder to fill. The pipelines that were previously built in some of the college recruiting that we've done have diminished because not as many people are going to college for the same types of roles. And then ultimately, I would say the other thing that's impacting us in healthcare uniquely in relation to the rest of the labor shortage is that our financial models don't change because of the labor shortage, right? So as other industries are able to raise their prices or adjust their hours of operation, for example, to be able to deal with their staffing crisis, we don't get that luxury. We are a 24/7 business. We need our staff there, and ultimately, we don't have the flexibility since a large portion of our income stream is tied to various payment models, including the government and insurance companies, to adjust our prices on the fly, to adjust our wages, to be able to recruit people differently. I was actually just talking to somebody that I know who works in the hotel space, and they said, we don't feel the same pressure as you because if we don't open our restaurant until 5 o'clock that night, then we don't open the restaurant. It's not that big of a deal. Versus in healthcare, people's lives are on the line.